Animals can sometimes carry harmful germs that can spread to people and cause illness. These are known as zoonotic diseases or zoonosis. Zoonotic diseases are caused by harmful germs like viruses, bacteria, parasites, and fungi. These germs can cause many different types of illnesses in people and animals, ranging from mild to serious and sometimes even death. These infectious diseases, while having been nearly eradicated before the start of the war, are now spreading rapidly, according to Dr. Ria Isaias, deputy head of Tigray Health Bureau. 42 people have lost their lives due to rabies and 12 others due to anthrax.
Currently, we are having this reports of zoonotic disease such as anthrax and rabies coming from the community. We know that anthrax is a reportable case. We should get a report immediately from the community within 24 hours. So due to the siege and destruction of the health information system in Tigray, we are not getting this information as fast as possible. And because of this, we just receive reports from the community that there are cases. Till now, we have 116 cases from the community, of course, from almost all zones except the western zone that it is under the expansionist. So the 116 cases with a total of 12 days is reported, and those reporting radas are almost 18, though they are from almost the 6 zones. So currently, this is status of anthrax, and also we are getting cases for rabies as well. So rabies case is also prevalent now, and then before the war there were cases, but the days was insignificant. I mean, it was too low, that 1 or 2. But currently, the cases that are reported as dog bite are more than in hundreds actually, but the days is significant, like almost 42 days report was encountered till now. And then we believe that this report is underreported because as I mentioned, the health information system is distracted, looted. So the information, the health information system is incapable of delivering the adequate and timely reports.
The deputy head emphasizes that the rapid spread of these infectious diseases is only possible due to the near-complete collapse of Tigray's health system that has occurred as a result of the deliberate destruction of its infrastructures by invading forces and the ongoing siege that has meant that Tigray's health system is no longer capable of designing and implementing interventions to curb the spread of these infectious diseases, resulting in the rapid spread of rabies, anthrax, and other diseases.
The zoonotic disease is we can be prevented in collaboration with different sectors and by mobilizing society, like implementing this community-based health system. And particularly zoonotic disease, we just prevent by administrating or by mass vaccination to animals. For example, for instance, if we take anthrax, by vaccinating those herbivorous animals like cattle and goat, sheep, we can prevent with this modality. And if we vaccinate, that's the prevalence of the disease will significantly reduce. But currently, because of the siege, because of lack of medicine, because of lack of supplies, such as vaccine, those diseases become prevalent enough in the society because the society lives with animals are not vaccinated, and the disease is becoming more prevalent.
According to Dr. Rie, the situation has been exacerbated by the blockade on essential items, as many households are forced to consume carcasses that were affected by anthrax as a way of fending off hunger.
This anthrax infection is affecting the people by different modalities, by contact, because it is having 3 types, like by ingesting this infected carcass, and the other is inhalational. We are advocating that to our people that this practice is dangerous, but because of the siege, because of the hunger, our people is eating this infected carcass. So sadly, I don't know how to explain, but our people is telling us they are choosing to die by eating this infected carcass rather than dying because of lack of food.
Malaria is also rapidly spreading, according to the deputy head, needlessly costing the lives of many in Tigray due to lack of materials necessary for preventing the infectious disease.
For the past almost 2 years, we didn't take these vector control measures, and now for the past almost 17, 18 months, we didn't get any medication for malaria. We didn't get any diagnostic kits for malaria. So those cases are becoming outbreaks. Like more than 10 waradas now, there is a high prevalence and high infectious rate of this malaria cases.
The deputy head noted that the rapid spread of these zoonosis diseases in Tigray may come to produce a new kind of infectious disease that could pose a danger to the world, as the medical system in Tigray remains too weak to effectively respond to medical emergencies.
The current situation of communicable disease in Tigray is high. In such kind of crisis, the epidemics and pandemics are becoming a source. So Tigray might be the source for a new emerging event or new pandemic disease, because we are not intervening, we are not preventing. Zoonotic diseases are becoming prevalent. Animal vaccination and animal prevent those zoonotic diseases. We are not making an intervention measure. So if you do this, then we are expecting something to happen.